So what implications does this have for the frameworks in which we all work? The value frameworks. Well, I think we need to start looking again at outcomes when we start to consider person-centered coordinated care. I think we need to recognize that clinical outcomes are important, but are not everything. They're not necessarily the key performance indicators. As Michael Porter's critique of value from Harvard has shown, outcomes from a single service, a single contact, are not adequate, particularly for chronic patients who are having complex contacts. So you need to have something that is a little more global than that. But what we're talking about here is understanding value from the person's point of view, and that it has many dimensions: personal, familial, community. And that the outcomes happen over time. We're talking about continuity of relationships. And as I've been sort of pointing towards, we may be thinking more in terms of well-being type outcomes than more granular, simply health status indicators. So in the piece of work, the discussion paper that we've done for this project, here are some of the suggestions we made: that you measure the overall impacts which are achieved together by people, communities, and formal systems. That those impacts need to be somewhat longer term and a different type of measure. I've mentioned already things like well-being, independence, social capital and connections, quality of life. And if we're talking to people about what matters to them, and we're talking to groups of people about what matters to them, then we need to be co-producing those outcomes. We need to know what outcomes are important to them. A colleague from New Zealand presenting this morning gave the example of a man whose goal was to walk his daughter down the aisle of the church for her wedding. The clinician's goal was for him to lose weight. Okay, but that wasn't very meaningful to him. He wanted to be fit enough and well enough to walk his daughter down the aisle. Okay, and the weight issue will be taken care of if you support the person to achieve that life goal. So we're talking more about life goals, I think.